Hello, my name is Dr. Tracy Irura, a radiation oncologist at the Kenyatta University Teaching, Research and Referral Hospital. In Kenya, cancer is the third leading cause of death after cardiovascular and infectious diseases. Currently, we are seeing up to 22,000 new cases of cancer annually. The top 5 cancers are breast cancer, cervical cancer, prostate cancer, esophageal cancer, and colorectal cancer. This World Cancer Day, the theme is Bridging the Cancer Gap. The main challenges we encounter are stigmatization of our patients, lack of awareness about cancer, lack of professionals to see these patients, and the high cancer financial burden. At KUTRH, we are able to combat these challenges and therefore close the cancer care gap by doing the following. We have the state-of-the-art modern equipment that is able to deliver internal and external precise radiotherapy to our patients. We are able to raise awareness of cancer amongst our population. We have multidisciplinary teams that consist of radiation oncologists, pediatric oncologists, palliative care nurses, and many others that are able to comprehensively discuss patient care. We accept NHIs. This immensely reduces the financial burden of cancer to our patients. We also conduct cancer screening programs throughout the year. This leads to early diagnosis of cancer.
Hello everyone, this is Dr. Harish. I'm consultant radiologist and nuclear medicine working at KUTRH. So today I'm here to talk about this year's World Cancer Day theme, which is closing the cancer care gap. The gaps usually encountered with diagnosis of cancer and the management, it starts from imaging. So earlier what used to happen, there used to be what we call it as a conventional imaging, that is the previous generation machines, which could only tell us anatomical details of the disease. So what used to happen, like many of the oncologists, they try to prescribe the treatment to the patients, whereby when they do follow-up imaging, they were not aware of whether the disease is in active state or it has resolved or it is still in stable condition. So to actually close the gap of this diagnosis, what KUTRH has done is they've got some new digital machines, be it 2 PET CT scans or even a SPECT CT, which can actually detect the functional abnormality in the body, whereby earlier conventional images could not actually detect it. So what it does to the patient and physician is, once it has been detected, it will allow the physician to further to continue the treatment with what is ongoing, or in case if there is a progression or if there is no response, he will have an opportunity to change the treatment a bit so that the patient will benefit from the same. This was not possible, if you ask me, like maybe a few years back, whereby we just had the conventional imaging. But currently with this setup, we can definitely watch through the treatment and see if the patient is getting benefited or not. So that is one of the major gap which has been closed by KUTRH and team. And I would say that this one has actually come as a boost to Kenyans, because to get the same kind of diagnosis earlier, patients used to go out of the country, be it South Africa, be it India, or maybe UK. Currently, with this kind of hybrid imaging and the digital PET CTs which we have now, there is no reason why the patients have to go outside to seek maybe a diagnosis or even treatment, for example. I think this is one of the biggest what do you call it, the change which the country has seen recently, and this is going to help many Kenyans in future. And that's something which actually, if you look at any public hospital, they couldn't have dreamt of. So KUTRH as a first public hospital, not just in the Kenya itself, but whole of the East Africa and Sub-Saharan Africa, they have come up with such a expensive machines just for the benefit of public, so that no patients will go travel outside the country to get the desired treatment or maybe a diagnosis. So we also have what do you call the team which actually takes care of these patients, be it at hospitality center or even at IME. So patients just come here as a one start stop, whereby they seek diagnosis. As once the cancer has been diagnosed, they also have an option of seeing our oncologist and discussing the further management for the same.
My name is Dr. Elizabeth Itotia. I'm a radio pharmacist at Kenyatta University, teaching referral and research hospital. The work of a radio pharmacist is to manufacture a drug called FDG, and this drug is used for the diagnosis of various diseases, including cancer. The theme for this year's World Cancer Day is closing the cancer care gap. One of the gaps that has been there in terms of management of cancer patients is the lack of the equipment and the technology to manufacture this drug called FDG that is used for the diagnosis of patients with cancer. This cyclotron that produces this drug called FDG is the biggest in the region and the first in a public facility in East and Central Africa. It has the capability to produce FDG for in-house use, that is for use at KU referral, so all our patients can be sure that they'll be here and the drug is available. In addition, this cyclotron can produce FDG that can be distributed to other facilities in the country, all the 47 counties, as well as the region.